Did you know that annually there are an estimated 2.5 million hospital-acquired infections? There are 90,000 deaths annually associated with these infections. The annual cost is approximately $4.5 billion. This is according to a report from American Journal of Critical Care in 2015. Research suggests that compliance and proper hand hygiene in the healthcare setting can reduce medical costs by reducing the spread of hospital-acquired infections and reducing the use of antibiotics. Today I will discuss 2 points regarding proper hand hygiene in a clinical setting. First, compliance of proper hand hygiene reduces rates of hospital-acquired infections. Second, reducing rates of hospital-acquired infections will also reduce the use of antibiotics by reducing the spread of harmful bacteria. My first point is that in healthcare, patient safety is mandatory. According to the Canadian Journal of Infection Control, increasing hand hygiene compliance rates will increase patient protection. That's in 2015. Healthcare workers who comply with hand hygiene are automatically keeping patients safe by reducing risk of infections acquired in the hospital setting. The American Journal of Critical Care in 2015 stated a decreased rate of hospital-acquired infections was observed after the implementation of new patient hand hygiene protocol, as well as implement of nurse hand hygiene compliance. Patient education regarding infection prevention and the importance of hand hygiene for the patient is a large factor in preventing healthcare-associated infections. In the Journal of Infection Control, in the Canadian Journal of Infection Control in 2015, it is important to encourage patients to advocate for hand hygiene. Most patients understand the benefit of proper hand hygiene but lack the confidence to advocate for it. Most care providers are receptive and cooperative to patients when they advocate for patient hand hygiene. In my visual aid, you will see that there are 5 moments for hand hygiene. This is according to the World Health Organization in 2009. First, before touching the patient. Second, before a clean or aseptic procedure. Third, after any risk of a body fluid exposure. Fourth, after touching the patient. And finally, 5, after touching the patient's surroundings. My second point is reducing rates of hospital-acquired infections will reduce the need or the use of antibiotics and reduce healthcare costs. According to a 2011 study found in Chicago Archives of Surgery, patients who have experienced a trauma and that were also affected by hospital-acquired infections have higher inpatient costs due to increased antibiotic use, longer length of stay, and have increased risk in mortality. This same report also states that increased cost of healthcare and use of antibiotics is preventable. For care providers, understanding the clinical and financial impact of hospital-acquired infections on patients may increase compliance and implementation of best practice for infection control. Respiratory tract infections and urinary tract infections are some of the most common hospital-acquired infections. These infections need prescribed antibiotics. By reducing these infections, we are already reducing the need for antibiotics. In conclusion, increasing compliance of proper hand hygiene among healthcare workers and patients in the healthcare setting will reduce medical costs. This is done by reducing the need of antibiotics and reducing the spread of hospital-acquired infections. Today, we have discussed the most important aspect of healthcare is patient safety. Compliance of hand hygiene among healthcare workers will reduce the risk of hospital-acquired infections. By reducing the rate of these infections, we will reduce healthcare costs and reduce the use of antibiotics. As healthcare professionals, we have a responsibility for patient safety. The first step in patient safety is proper hand hygiene. Compliance in hand hygiene will reduce patient costs by reducing length of stay in the hospital and by reducing the need for antibiotics.